nurse practitioner from Contra Costa Health Services, Dr. Dipti Barrow, a COVID provider from Lifelong Medical Care, and Dr. Raul Parikh, Pediatrician, Assistant Physician-in-Chief at Kaiser Permanente Delta Service Area, and the Physician Lead for the COVID program. So I really appreciate the panelists tonight. I do want to remind myself and remind everybody else to speak a little slower because we have translators and interpreters tonight. So we're going to speak a little slower. So with that, I'm going to hand it off to Nikki, who is going to start our presentation.
Hi, thank you. Thanks, Lynn. Appreciate that. Good evening, everyone, and thank you for joining us for this town hall. We're really excited to share about the approval of the 5 to 11-year-old COVID vaccine and have this opportunity to share that information and answer questions that many of you may have. We do have the panelists here to join us as well. Next slide. I think, Michelle, can you hear me? Thank you. Dr. Parikh and Dr. Bharat, thank you for joining us today. Appreciate it. Next slide. So we'll start off by talking a little bit about COVID in our county here in Contra Costa. We'll talk about the history of vaccines a little bit, and then we'll go over the COVID vaccines for children, the benefits and safety and the approval process. And then how to get those an appointment for a COVID vaccine, and then open it up for the question and answer session with our panelists. Next slide. So in Contra Costa County, so this slide is from our dashboard, and what this slide shows us is the current case rate in Contra Costa was about 1,100 as of Monday. And when you look at this, the burden of the cases, what's really driving the cases right now is this age group, 5 to 11 years old. And you can see that bar for the 5 to 11 is the one that extends out. And that's where the most of the cases are right now. In the US alone, we have seen almost 2 million kids contract COVID-19. And about 8,300 of those have been hospitalized. And as of this week, looking at the CDC dashboard, they have about 897 pediatric patients have died, and about 189 of those were age 5 to 11 years old. So what that makes is that COVID is now in the top 10 causes of death for children in the United States right now. So this COVID-19 is really impacting our pediatric population. We are also looking at those cases. We have, as of October, about 5,200 cases of COVID-linked multi-system inflammatory syndrome in children. And of those cases in the United States, of kids who have COVID, about 8% of kids who contract COVID in the United States will experience long COVID symptoms that persist for weeks and even months. What we're seeing in Contra Costa County is very similar across the rest of the United States. What's happening right now, especially with many children that are going back to school and participating in sports and extracurricular activities and social activities. So vaccinating this age group can really reduce the number of kids that are contracting COVID in this population and reduce that chance of severe disease, and actually decrease the amount of missed school days that we're seeing that these children are missing in the community. Next slide. So this chart this shows us the impact. This is actually for over 18 and older, but this shows us the number of people who have been admitted to the hospital who were vaccinated versus unvaccinated. And you can see that top green line is significant during the spike we saw in the end of the summer. Is in the unvaccinated population. We're seeing that those that are hospitalized typically are people who are not fully vaccinated. The hospitalizations among unvaccinated adolescents, when we just pull out adolescents, it's 10 times higher than those adolescents who are fully vaccinated. Next slide. So the history of vaccines for children. Now, we vaccinate children for a number of diseases. We vaccinate for measles and mumps and pertussis and polio and hepatitis and chickenpox. When we look at the amount of deaths each year in those who are unvaccinated or even incompletely vaccinated from disease, it's about 300 deaths per year. But since January in 2020, COVID alone has killed more than that. So 897 children in the US alone, and that's more than all these other diseases combined. Next slide. The vaccine approval process. So for vaccines, for adults and for children, they all go through the same process where the clinical trials data, they'll be studying the vaccine, and they will present their data to an FDA advisory panel. And when they present it to the FDA spends time looking over the data. They have a discussion about it. They ask a lot of questions. And then we'll decide whether or not they are going to approve that vaccine. It's a very vigorous process. Sometimes the FDA will ask that company, that manufacturer, to go back and get more data if they don't feel that they have enough info to determine if it's safety or effectiveness. And once the FDA approves it, it then goes to the CDC, where their advisory panel will also review all of the data and the information from the FDA as well. And they'll have an open discussion about it with many specialists as well. Once the panel the advisory panel approves that, then the CDC will make a recommendation. Now here in the California, we have an additional loop for vaccines to go through, and that's through the Western State Scientific Review Work Group. And so they will also look at the data and then approve it before we can start vaccinating here in California. So this is a very, very thorough process of evaluation. Next slide. So when we look at the clinical trial data from Pfizer, they had a total of 4,647 children that were enrolled in this group that originally started with 2,268, and then they added an additional safety expansion group of another 2,379 kids. When we look at who actually received the vaccine and who received placebo, a little over 3,100 received the vaccine. And when they started with the vaccine, they looked to see first, did the older teen adult dose, was that safe and effective? They did find that it was safe and effective, but they found that kids with the adult older teen dose were having a little bit more side effects. They were having more fever and body aches. So they then went back and started looking at, well, can we give them a smaller dose that will be just as effective, but have less side effects? And that's where we have the pediatric dose today. They found that this pediatric dose had an antibody response, an immune response that was comparable to the older age group, but then had much less, more mild side effects than the older teen adult dose. So it's kind of a happy place, right? I would say the most common side effects is the sore arm, which can happen with any vaccine. And then about 39% of the study participants reported feeling tired, and about 28% reported having headache. Less common, there were fever, chills, and joint pain. They also found that this clinical trial was done in the setting of Delta, and so this vaccine is effective against the Delta variant. Next slide. So like I mentioned, this vaccine is a smaller dose. It's about 1/3 of the adult and teen dose. And so it's the same vaccine, it's just a smaller dose. There were no serious reactions in this study. And they looked at the immune response, and that was it was similar to that in the older teens. And they also found that it was about almost 91% effective at preventing COVID-19 infection in children age 5 to 11. So very highly effective vaccine. Next slide. The COVID vaccine, so now that particularly Pfizer, there are hundreds of millions of in the US alone, of kids 16 and older that have been vaccinated. And we have millions of children that are 12 to 15 who have been vaccinated. So we have a lot of real world safety experience to show us that this vaccine, is safe and effective, just like the clinical trials showed us. But now we have this real world data to back that up as well. And just an interesting note, 89% of our county teens age 12 to 15 are at least partially vaccinated right now. And that's pretty exciting for those of us, especially in public health, to really see so many of our teens are doing really well and are on their way to being fully vaccinated. Next slide. Now with the mRNA vaccine, so with Pfizer, there was we call it a safety signal. Basically, in some of the older teens and young adults, there was a very rare instances of myocarditis or pericarditis, which is a rare heart inflammation that was reported. And it was in mostly males, typically males under 30, and it was usually after their second dose. We really kind of saw it in the older teens, in the 16 to 29. It was less in the 12 to 15-year-olds. Now, this myocarditis, these cases, vaccine-induced myocarditis, were all mild and self-resolving, and they had no long-term effects. We're really thinking that the risk of myocarditis after vaccinating in the 5 to 11 age group may be even lower. Next slide. It's also important to note that they did not find any myocarditis, any vaccine-induced myocarditis in the clinical trial at all. Now, talking about vaccine-induced myocarditis versus a classic or infection-related myocarditis. Myocarditis from an infection like catching COVID is much more severe. It has a much higher mortality rate, and about 20 to 30% of patients who are people who are hospitalized with COVID will develop heart problems. Vaccine-induced myocarditis is different. It's much, much milder, and kids recover typically in less than a month. So if we put it into a perspective, for every 1 million boys or young men who are vaccinated, we'll expect maybe about 40 cases of myocarditis out of that million injections. And most of those are mild and will go away. But in the meantime, we will have prevented over 11,000 cases of COVID, 560 hospitalizations, and over 100 ICU admissions, and including 6 deaths due to COVID, and just in the first 4 months after vaccination. So next slide. So why should we vaccinate our kids? I hear this a lot in my own practice. I practice pediatric primary care out in the Pittsburgh, Antioch community. And so why should I vaccinate my kids? Well, A, the vaccines are safe and effective. 2, getting vaccinated keeps our kids in school. So kids who are fully vaccinated, if they come in contact or exposed to someone with COVID, they don't need to quarantine as long as they remain symptom-free. They can keep going to school. They can go to their extracurricular activities. Also, number 3, the vaccines really limit the spread of COVID-19. So overall, kids do tend to get less sick than adults, but they can still get COVID, and they can still spread the virus. And they can spread the virus to those in our community who are more vulnerable. So the more people who are vaccinated, the less the COVID will be spreading through our community. Next slide. Where you can find a vaccine, our cchealth.org website. We have the Get Vaccinated page, there's info, and there's scheduling links to all of our community partners as well. So you can check with your primary care provider. Our website also has links to like Kaiser and all our community partners, their scheduling systems, pharmacies. We have community vaccine sites as well as county vaccine clinics. We have also partnered with other healthcare providers like La Clinica, Lifelong, John Muir, and Kaiser to do school-based vaccination clinics that started this week. So if your school is hosting a site, your school will reach out to you. We are also prioritizing schools in communities that have been hit hardest by COVID. So those schools you'll be seeing vaccine clinics at those schools first. Next slide. And thank you so much.
Thank you, Nikki. I really appreciate that information. I know a lot of that presentation answered some of the questions that were submitted to us during the last presentation, but I do have some follow-up that we took from the last Q&A. We gathered them. They were really hit about 5 different themes. Some were just around the study process, some were around whether you personally as doctors would recommend this and would you have your own children vaccinated, and then some were about process and procedure. So I'm going to ask those questions. I'm going to direct them to each one of you, and then I will ask you specific questions. And then when we're done, I will go into this Q&A and see if there's any follow-up questions that weren't answered. So I'm going to start with Dr. Peru. Are you there, Raul?
Hi, good evening.
Yes, so I have my first question to you. As a pediatrician, what would you tell your patients, the families? Would you recommend them getting the vaccine? Why? And would you vaccinate your own children? That was a really hot question last time. Would you vaccinate your own children and why?
Yeah, the answer to that's pretty straightforward for me. And I did vaccinate my daughter, my 11-year-old, last Saturday at our Kaiser Walnut Creek Clinic. And, it was a big milestone for my family and I, and kind of emotional. I mean, my 13-year-old had been vaccinated earlier. My 11-year-old was the last one waiting. And, what's remarkable and I think gives me a lot of hope about kids in the future is how excited they were about how excited she was, how excited her friends are at school about the possibility of getting vaccinated, because they have heard about the protection that they want to have against this disease. And in having that protection, it allows them to go to school maybe without masks very soon, go to sleepovers, feel comfortable getting on planes with their family to go on vacation over the holidays and sit with their grandparents who also may be vaccinated, but because of their age or their conditions, may be more vulnerable. And then I had a couple of other patients in my office just the other day, a couple of little girls with their dad who brought them in for a checkup, who were really just so excited. And they were talking about how the vaccine provides this bubble of protection for them. And I said, you probably should just work with us because you're really good at explaining that to people. So just that energy, that I think that anticipation that people have is a really great draw and pull. Our goal is to get all those kids vaccinated, continue to vaccinate their parents. And then, as I think working with the county bring the vaccine as close as we can to the students at school where they're at right now and get them vaccinated. We started those efforts today and we're pretty proud of what we've done the first day. So I absolutely get them vaccinated. It's safe and effective. It allows us to all get back to feeling closer to what life was like before the pandemic, including things like masks and testing and, everything that feels normal now and kind of secondhand, but we can go back to something better than that.
What if there was quite a few questions about just basic distrust? Like if I distrust this information that was provided tonight, where would I go to seek out specific studies? And how do you feel about those studies? Like where would you recommend a family who comes to you and say, I don't believe this, where can I go get my own facts?
Yeah. Well, first, I want to say that you can certainly go to trusted places. Well, places that I would trust, the CDC, the NIH, the FDA. I know a lot of people feel suspicious of government right now, but these are physicians and scientists who've done their diligence. And in fact, set up a lot of alarm, including worry from the American Academy of Pediatrics, my professional organization, over the summer, when they told the drug companies do not progress with your study until you add more patients to it. They're the ones that put the brakes on Pfizer and Moderna in terms of testing and submitting the vaccine for earlier approval because of the pericarditis that was just meant, the risk of pericarditis was mentioned. They wanted to know, we need to prove to ourselves this is safe. It is not going to cause undue harm to children. So certainly I view the information coming from there, the summary and the data coming from the scientists as being trustworthy. Science is complicated though. And so what I try and tell my patients is, look, if you have questions about this or a vaccine, show me where you're getting your information from, and let me look at it and help you understand it. And let's have a conversation about it. So because I think we do need some help sometimes in interpreting things that are complicated, just like I would need help interpreting something from an attorney about it, or an accountant or a banker about something that's financial. We all need help like that. And I think physicians are certainly very qualified to do that. And the trust we have with our patients is really paramount to that.
Thank you, Doctor. Now, if my child is almost 12, so if my child's going to be 12 in a month, which dose do I wait and get the 12-year-old dose, or do I get it now with the 11-year-old?
I think that's more of a choice. I can tell you based on the rules, and I apologize if you hear a dog barking in the background. She's excited about the vaccine as well, I guess. The FDA approved the dosing based on age. It was, if you're under 11, you get the 5 to 11 dose, and if you're over 12. So in some ways it's very arbitrary, because we know in pediatrics, we generally dose medicines by a child's size or weight in particular, in kilograms. But that's not the way we wanted to do it. And for safety and quality reasons, it's much better to be able to administer the vaccine that way by age than have to worry about weight. It allows us to be more efficient and safe in administering the vaccine. So I leave it up to a parent to wait. Maybe you've got a holiday coming up where you're going to be around people and you want to protect your child sooner. Maybe you've got time and you're willing to wait. Either way is okay, but I think the idea and the intent to get vaccinated is much appreciated, I think.
Thank you. I'm going to jump over to Dr. Barot. Am I pronouncing your last name?
It's Dr. Barot. You pronounce the T.
Thank you. Thank you. I'm going to start with the same first question. What would you tell you're a pediatrician? What would you be telling your families about this? And would you get your own children vaccinated?
Okay, so I'm a family practice doc, so I definitely see kids. And I have an 11-year-old in my life who got his first shot on Friday and was super excited as well. We have been very careful around his grandparents because they have conditions that make them more vulnerable. And, realistically, most grandparents have the condition of age that makes them more vulnerable beyond, they might have diabetes, hypertension, cancers, all sorts of things. So he said, the first thing I'm going to do is I'm going to take my mask off at Dada and Dadi's house. And I said, whoa, buddy, Dada and Dadi might not want to take that risk, even with, so that's up to them. It's their health. They get to, choose. But definitely, I texted every single person who has a child in that 5 to 11 age range, just to remind them as soon as appointments opened up. So there isn't a loved one in that age group whose parent I did not text or call and make sure that they were getting on it, especially given the time, especially given that we're coming up on holidays, we're coming up on cold weather. And, in the last couple of weeks, we're seeing rates of infections and hospitalizations climb in California. So we are seeing things trend in an uncomfortable way. And all of us are holding our breath to see what the next few months will look like. And, as one of the COVID providers in my clinic, it's been a heck of a journey because, some months are shift or slow. So we get to sit and read up on the research. And then all of a sudden, boom, cases start rising and we're nonstop talking to patients who are symptomatic, sending them for testing, et cetera, et cetera. So it's been a real roller coaster. And, it would be great to not be busy over the next few months as a COVID provider. There isn't a single person who wants to see those rates keep climbing, but that's just the reality of where we are. So 100%. And in terms of the 11 versus 12, especially given the holidays, I don't know how quickly the 11-year-old will turn 12. I would just recommend getting it I would recommend getting it. I know a lot of it has to do with immunologic age versus that weight, which is why they did it the way they did it. And, in these studies, they will take, a whole range of, genders, weights, heights, et cetera, and they really take into account differences. But, my personal opinion, if you have an 11-year-old who's going to turn 12, unless it's like next week, I would want them protected for the holidays and just the cold weather.
Why is this, there was a lot of questions about the differences between this and, let's say, a measles vaccine, where people are still getting sick after they get this vaccine. And I don't know do people not get sick after the measles vaccine? I'm not sure, but there were a lot of questions. Why does this seem different from those other vaccines as far as keeping people from getting sick?
Yeah, so no vaccine is 100%. And even with measles, we might have heard in recent years that there have been outbreaks of measles in certain communities. And part of what helps protect us from these, viruses. So for example, we haven't had polio in America for decades, but we still give the polio vaccine because there are still countries where polio still exists. And so we're still protecting people from what's out there. Ideally, our vaccination rates would have been so high that we would have protected each other with this sort of bubble of protection through herd immunity. And a lot of people say, well, you guys aren't talking about sort of natural immunity from the virus. And we know people do have antibodies after they get the virus. The only problem is it's no guarantee. So it's about 1 in 4, 1 in 3 people 3 weeks after getting the virus, you've recovered from the virus. We check about 3 weeks out. You may or may not have antibodies. So yes, there's absolutely a component where if you've had the virus and you've recovered, there's a good chance that you may have antibodies, but it's not a guarantee. And for a virus like this, where, we passed our 750,000 mark just recently. And in terms of just yesterday, I looked up this number for this talk. Yesterday's death count, death by COVID, was 1,678. So that's 1,678 people in the United States died yesterday. That's basically, a 9/11 every 2 days. So we're still in this pandemic, and we need to do our best to kind of create this wall of protection for those of us in our communities who are less vulnerable. Part of the reasons we have measles outbreaks are that we have a drop in the percentage of vaccinated, and boom, the virus is allowed to spread quite freely. And the same goes with the COVID virus. It's allowed to spread more freely in communities where we have lower rates of vaccination.
Could you speak just a little more about the heart thing? Because that is a big concern. Could this vaccine give my child a heart defect?
Yeah, so, Nikki had a great presentation that had some of those numbers. I sort of looked this up anticipating this. So what I will say is that those cases were primarily in that young age group in males. And the reality is the risk of pericarditis and myocarditis is so significantly higher with actually getting COVID that we do think that the benefit of it far outweighs the risk. And there's this hyper focus on the myocarditis and pericarditis, but what I don't want people to forget is when you zoom out and you see what are the kinds of things that happen once you get very sick from COVID, people oftentimes are forgetting the strokes, the heart attacks, the kidney failures, the amputations because of blood clots. There's a whole host of things, not just pericarditis and myocarditis, that can be caused by the virus itself. And, there are new amputees all over the world right now because of blood clots from COVID. And so I understand why there is this concern, and certainly nobody wants to do something that might be risky for their child. But what I will say is that getting COVID is way more risky than any risks of this vaccine.
Thank you, Doctor. I'm going to jump to Dr. Ferrantano. I'm going to open with the same question. I know you work with young people, you work with their parents. Do you have any other tips of what you would talk to them about if they came to you wondering if they should get the vaccine? And if you have children, did you get your children vaccinated?
Thanks, Lynn. My kids are all grown. I have sons in their 20s who I encouraged to get vaccinated, and they all did get vaccinated, which made me really happy. I am a practicing family physician, so I do see kids in my practice, and I am really strongly encouraging parents to get their kids vaccinated for all those same reasons. COVID is still out there. It's still a real threat. You know, over 800 children have lost their lives to COVID since this pandemic began. It's a real tragedy. It's devastating for a family to lose a child. There have been no children who have died from the vaccine. Even the studies in this age group 5 to 11, they have not seen any cases of myocarditis. And as the other speakers mentioned, you know, we see it mostly in older teens and young adult males after puberty. So there's very good reason to expect we will not see myocarditis in this age group, or if we do, it's going to be even rarer. And so it's a very, so the three reasons to get a vaccine is it safe? Is it effective? And is it necessary? And this vaccine is definitely safe. It's definitely effective, 91% effective in preventing COVID, probably even more effective at preventing hospitalization in this age group. Although the numbers are small, so we don't have great calculations, but we certainly see in older groups even more effective in preventing severe disease. And is it necessary? And I think Nurse Practitioner Brito went over all those reasons why it's necessary, why COVID, less of a threat to kids, but still a threat to kids' health. We want to avoid those illnesses in kids. And the other, benefit of keeping kids in school. So, a kid who's vaccinated and they get exposed to somebody with COVID, they don't have to quarantine. They don't have to miss a week or two of school. As long as they remain asymptomatic, they continue to go to school, continue to go to after school activities, don't have to quarantine. So keeping kids in school after this, very difficult year, parents and kids have all gone through missing in-person education. Really important to keep kids in school this year. And then again, protecting the whole family, that child, if they got COVID, maybe they won't get that sick, but could they pass it to their grandparent? Could they pass it to somebody who's really vulnerable? So for all those reasons, it's necessary, it's effective, and it's safe.
So will this be more like a flu shot that we recommended we get every year, or will it be more like a measles where you get it at childhood and maybe a booster later on?
No one really knows yet. We know certainly with the talk and the discussion around boosters for adults, the most compelling evidence was in older adults, because we know older adults, their immune response tends to fade quicker. Younger adults and kids, they get a great long-lasting immune response to vaccines. That's why part of the reason why we do so many vaccines in kids. They get these great immune responses that really last a long time. And only time will tell, how long it will last and when they'll need a booster. But there's very good chance that kids and young adults and teenagers may not need to be boosted as often as older adults need to. Take the measles vaccine, for example. Right now we give a dose at about a year of age. We thought that was enough for a long time, and then we were finding outbreaks of measles in college age young adults. And then we realized, hey, we needed to give a second dose, which we now usually give around kindergarten age. But that second dose really looks like it lasts well into adulthood. And so only time will tell, if a booster is needed for kids, and then if just a single booster, and that will be good for life, or there will be more boosters, maybe a few years apart. But most vaccines we see, if boosters are given, they often can be spaced further out over time, because each dose boosts the long-lasting effect even longer than the dose before.
Let's talk just a little bit about consent. And so let's say we have a school clinic. I've had parents reach out and that do not want to get their children vaccinated. That's the choice they're making right now, but they're afraid if they send their child to a school that has a vaccine clinic, that somehow their child might get vaccinated. Is that possible, or do you need a parental consent and parental acknowledgement, or even a parent or guardian there in order to get vaccinated?
Parental consent is definitely needed for kids to get vaccinated with the COVID vaccine. Now, in most cases for young kids, we really want to have the parent there, because it's a anxiety-provoking thing for a small child to get a vaccine. They want to have their parent there. For some of the older kids, a lot of the vaccine sites are allowing a form to be brought with the child if the parent can't be there with the child, so the parent can sign a form. If an older child, a teenager shows up asking for a vaccine and the parent's not present and they don't have a form, some sites are able to phone the parent and talk to the parent over the phone and get that verbal consent over the phone. But in every case, we definitely want the parent's consent, the parent's approval before a child is vaccinated.
Thank you. I know that's very, very important to parents out there. So there was a question about and I think it was answered earlier, but if my child already had COVID and I test them regularly, like for antibodies, if there's a good antibody test, would that be sufficient, or should I still get the vaccine?
There's no real good standard about antibody tests and the level of antibodies that really provide the same level of protection as the vaccine. During the pandemic, the FDA approved a lot of different antibody tests and under what they call emergency use authorization, but they have yet to sort of standardize exactly what level of antibody, because they're still studying this and still really trying to understand this. At what level of antibody are you getting the protection that is as good as that strong protection that comes from the vaccine? We know that the vaccine, it's a very measured standard dose that people get, a bigger dose for teens and adults, smaller dose for kids, but we know that that standard dose gives a very predictable level of protection. When people get a COVID infection, they can get very different levels of exposure to COVID, a mild case, a severe case, which can lead to very different levels of antibody response. And that antibody response may last a long time for some people, may last a short time. But we don't have a really good way of measuring and identifying whose level is good enough, strong enough, and how long that will last. We do know that people who've had COVID who get a COVID vaccine afterwards, they decrease their chance of getting a second COVID infection by at least 50%. So they cut their risk of getting a second COVID infection by at least half, if not more. So it's definitely recommended to get a COVID vaccine, even if you've had COVID, because all you're doing is you're just increasing your level of protection.
Thank you. Let's talk a little bit about the mandate. I know I immediately got questions about whether a mandate is taking effect right away. There was a little bit of confusion where some folks in the county thought all the school districts had a mandate, and then like after the holidays, they would have to come back vaccinated. And when I just want to share that that is not the case at all. There is actually, the mandate will be from the state level. The local school districts can have they have the local authority to do a local mandate that would happen before the state, but only one district in our county is doing that mandate, and that's West Contra. And for any of the West Contra families, they should go onto the website. They should be getting information regularly from the West Contra district. If you're not going to the website or give them a call, it will be by January 3rd, I believe is the date that you will need to show vaccination. But none of the other 18 school districts have a student mandate at this time. They're choosing to follow the state mandate. And what is the process for approval for the state mandate? Because I do know what I'm hearing from the state, it won't happen this school year. It doesn't sound like. It has to go through some final processes, correct, Dr. Fantano?
Yes. So the state has announced that there will be a mandate statewide that will go into effect some point after the FDA grants full approval for COVID vaccines, or at least one COVID vaccine in the 12 to 15 year age group. That hasn't happened yet. And the state has said that once it happens, the mandate will go into effect either January 1st or July 1st. They said very clearly that once that FDA approval happens, there's still some logistics that the state has to do and school districts have to do to get ready for the mandate. So if that FDA approval happens very close to the January 1st deadline, they're going to still go with the July 1st deadline. And at this point, we're in mid-November. I don't anticipate the state will start this mandate January 1st. I expect it will be July 1st mandate for the next school year starting in the fall. Now this will apply to only the ages that the vaccine has full approval. So this will be for kids 12 and older, and they said that's going to really essentially be 7th grade to 12th grade. So the younger kids, since we know it'll be a lot longer before the full FDA approval comes, the mandate won't go into effect for those younger grades till sometime after that.
How can a person opt out?
So since the governor has announced this through the governor's office, that the state legislature has deemed that if there is a mandate issued by CDPH or the governor's office and not by the state legislature, there must be a personal belief exemption allowed. So parents can claim a personal belief exemption at this time if they do not want to get their children vaccinated. Now, the legislature, if they meet in the spring and they pass a bill to add COVID vaccines to the list of other childhood vaccines that are mandated by the state legislature, that personal belief exemption will go away. And the only exemptions that will be allowed will be for medical exemptions by a licensed health professional. So there may be some changes between now and when the mandate goes into effect in July 1st, depending on whether the legislator takes action.
Thank you. And so I'm going to move from those questions that were from the last presentation. I'm going to go into the chat. It's a much more manageable size this time, the Q&A, and I'm just going to throw some out there to you all, and you can raise your hand, you can give me a nod if you feel like you can answer it. So how long after the COVID vaccine should I wait to get the flu shot for my child? Nikki?
Hi. So there is no need to wait any time period between getting the COVID vaccine and any other vaccine. So that includes other childhood vaccines that your child may be due, and including the flu shot. So there's no need to wait or a certain time frame. I did want to add that I'm a mom of 2 kids in this age group. I have a 7-year-old and an 11-year-old who just got their COVID shots today, as well as some of their other vaccines. And I think they wanted to offer some advice to any kids that may be listening in that the COVID shot was way better than the other ones, they said, to be reassured. But yeah, there's no need to wait in between.
Thank you. And then a few of these, why can't younger kids get vaccinated? I can't see when I read that. Does anybody have an answer? Dr. Ferrantano, do you have an answer to that? Why can't younger kids get vaccinated?
So I assume the question is referring to kids, yes, less than 5 years old.
Yeah.
And that's really because of the step-by-step careful way these studies are done. The studies are done first in adults, they started last summer, so we've already had 18 months or so of experience now between the clinical trials and after the approval of the experience of the vaccines in adults. Then they started trials in the older teens at 12 and 15-year-olds. And then after they had several months of safety data that's showing that the vaccines were safe in that age group, they began enrolling the trials in the 5 to 11-year-olds. Now they've started enrolling younger children, infants 6 months and older and toddlers in trials, now that we've seen it's safe in the elementary school age. So it's a step-by-step process. We always want to be very careful and protective of kids, especially small kids. So that's why we don't really start studying them until we've shown that it's safe in all those other groups. And so the approval then gets pushed back several months and delayed because we want to see that safety data. We want to see that experience. And so I anticipate eventually, the data we will have on the 6 month to 5-year-old or 4-year-old age group. And if that data shows that the vaccine is just as safe in that age group as it is for older kids and adults, then the FDA will authorize it. But that'll probably be, sometime in 2022 is what I expect.
Thank you. Are there any effects to my child's reproductive system? This question comes up a lot. It all seems so new. How do we know, how would we know those long-term effects?
Well, I would just say one thing about vaccines in general. Vaccines have short-term side effects, and some are mild, like sore arms and fever, and there can be rare, serious side effects. But vaccines are in your body for a few hours, a few days. Some of the live vaccines, like a measles vaccine, they can last in your system for a week or two. But the COVID vaccines are not live vaccines, so those proteins in the vaccine, they are broken down by the body within a few days. So the reactions we see are to the immune system, reacting to those proteins. And those side effects we see really occur in days or weeks after vaccination. We really don't see, side effects, brand new side effects popping up a year, 5 years, 10 years later after vaccines. And that's been our experience with the COVID vaccines. Again, 18 months since they started these large clinical trials in adults, they've been continuing to follow those people who were in those trials. They're not seeing new things show up 6 months, 12 months, a year later. And vaccines, really don't, we don't see other vaccines affecting the reproductive cycle. We don't see vaccines that are not live vaccines being any particular concern for pregnant women. So other non-live vaccines we routinely recommend pregnant women to get, like the whooping cough vaccine that's routinely recommended in pregnant women to get. We have seen a lot of experience, real world experience in pregnant women safely getting these vaccines. And we've also seen COVID itself, the COVID infection, being very dangerous and causing very severe infection in pregnancy. So I have a pregnant daughter-in-law who just had a baby. During her pregnancy, I recommended she get the COVID vaccine because it protected her, and those antibodies that she made get passed to the baby to give the baby some antibody protection after the baby's born as well. So we the American College of Obstetricians and Gynecologists strongly recommends pregnant women get vaccinated.
Thank you. Dr. Ward, was there anything you wanted to add to that? Or you...
Oh, sure. Yeah, I'll just add to that, you know, for these studies, they didn't enroll pregnant women. And that's really, there are a lot of things to say about how oftentimes these clinical studies exclude pregnant women. There's lots of conversation we could have about that, but you know, women are women and fertile women are fertile women. And some of those women got pregnant, and women who had actually, you know, not just in the placebo group, but in the women who received the COVID vaccine. And during the time frame, and you know, as you guys saw in the presentation, it's a real long process. A bunch of those women who had received the COVID vaccine did indeed get pregnant, just kind of by the by. So, you know, even though they didn't enroll pregnant women, you know, women became pregnant and went on to have successful pregnancies in the context of the trial while they were being watched.
Thank you. And my grandson has autism. Is there any side effects for him? Should she be cautious about getting her autistic grandson vaccinated?
I'm happy to take this one. Yeah. No, the short answer is no. Please don't hesitate to vaccinate your child if they have a diagnosis of autism or other developmental challenges or issues that may you know, raise a similar question. And I think this goes back, I think, to a prior sort of information or misinformation that was put out maybe 15 years ago around the link between vaccines and autism, which had been debunked, you know, significant, you know, many times in the literature. So I certainly would urge everyone to get their kids vaccinated, and whether they, you know, carry the diagnosis of autism or other things to make sure that they're safe.
Thank you.
I'm just going to add one thing to that. You know, if you are in doubt, we have these amazing specialists called immunologists. They know the immune system. They can look at your chart. They can see, hey, what do I think as I'm examining you, looking at you? What is my recommendation? And, you know, as long as you have a primary care doctor, there's no reason any primary care doctor or nurse practitioner or any clinician that you see who would hesitate giving you that referral. Right now, in the last 6-8 months, immunologists have been flooded with people who just want to come and have a chat, or maybe not even come, do it over the phone or have a video visit. So if you're in doubt and you think to yourself, I don't want to just talk to my primary care clinician, I want to talk to an expert. Well, there's a whole field. There are allergy immunology colleagues, and they're happy to have a further deeper discussion with you about your child and their special, whatever their needs are.
Thank you. We have a few more minutes. I want to hit a couple top ones, and then for the audience, we will take questions that maybe were not answered and try to roll them into the next presentation. And I think at the end of these, there will be an FAQ that comes out. There typically is by a state or local level that answers a lot of questions. But I have seen reports of a 16-year-old child dying from the vaccine in Texas. Is this a fact? Do you know if this is a fact, anybody? Dr. Ferrantano?
I'm not aware of any child. I can say with high confidence that not a single child or teen has died as a result of this vaccine. You know, there are in the United States, there were, with the Johnson & Johnson vaccine, there were, I think, 3 adult women who developed blood clots and then unfortunately died after getting the Johnson & Johnson vaccine. If you remember, that was when we paused, the FDA paused the vaccine until we could study this, see if how widespread this issue was, realized that this particular type of blood clot needed to be treated differently with different blood thinners than what were traditionally being used. So they took the time to educate providers on the proper treatment for these blood clots. And then they resumed the rollout of the Johnson & Johnson vaccine. Since that pause, there has not been another death from blood clots related to the vaccine. And since the beginning of the vaccines, there's not been a single death that's been due to any of these vaccines in kids. But again, 800 plus children and teens have died from the COVID infection since this pandemic has begun, and the pandemic's not over. So these vaccines, they're what's safe, and the COVID infection and going unvaccinated is what is putting children at risk.
Thank you, Dr. Ferrantano. I do want to offer anybody, if there's any closing, I'm going to first thank you all. Thank you so much for this information. I appreciate your time, and just very important, as an educator and as somebody who runs schools, I just think the vaccine is very important for us to run safe schools and to keep our children safe. So thank you for this information. And would anybody like to add anything as we close? Nikki.
Yeah, I just wanted to add that, one of the things that I talk to my patients about is I spend a lot of my work, my career studying this, and I would never recommend something for a patient of mine that I wouldn't wholeheartedly do for my own children. My patients are part of my family as well. And so, this is something I know that my colleagues, we share this, that we really wouldn't be recommending something that we wouldn't do for our own children.
Thank you, Nikki. Dr. Ferrantano, any?
Yeah, I would just really just want to close by thanking Nurse Practitioner Brito for her very thorough presentation today. And I want to thank Superintendent Mackey and the Office of Ed. You've been tremendous partners throughout this pandemic. It's been a really difficult past year and a half plus now for school-age children and their parents and their families. And I really appreciate the partnership with all the school leaders to help keep our kids safe and balance the needs of educating our children with school safety. I'm really hoping that the approval of this vaccine for children 5 to 11 will be a major step forward towards getting life back to normal for our families. I also want to thank our physician leaders today. John Muir and Lifelong have been tremendous partners throughout the pandemic, really stepping up with testing and vaccinations and helping speak to the public and all the other ways that they've really been great partners. It's really been an entire community healthcare response. Just again, remind people there's many ways you can get your child vaccinated. You can schedule appointments at our county vaccine clinics online at cchealth.org. You can go to your own pediatrician. You can go to your own health system, whether it's Kaiser or John Muir or one of the other large systems. Your school may be hosting a vaccine event. If so, your school will be reaching out to you and letting you know when that will be. But it's a really exciting time, and I'm very excited and hopeful that we're going to be able to protect our kids.
Thank you, Dr. Ferrantano, and thank you, Dr. Parikh from Kaiser Permanente and Dr. Bordeaux from Lifelong Medical Care and Nurse Practitioner Brito from our County Health Services. And thank you to our interpreters and our translators. We really appreciate that. Really helps reach a larger community with your support. So thank you and good night, everyone.
Thanks, Lynn.
Thanks.
Thank you, Jennifer. Thank you, Miss Pat. Hopefully we'll see you guys again. Have a great night, everyone. Be safe.
Thank you.
Thanks, Nikki. Thank you, Dr. Baruch.